Thank you so much for everyone who's joining us today. I am super excited for this educational webinar. So this is our second webinar in our series of webinars. This is a new initiative here at Well Beyond Breast Cancer, just to help bring more information to the community. We know that not everyone has access to a certified lymphedema therapist or a physical therapist or occupational therapist specialized in breast cancer rehabilitation. So this is just our way of bringing more information to you directly in the comfort of your home. So before we get started on the webinar, I just want to introduce who it is that we are. I'm Amanda. I'm the founder and executive director of Well Beyond Breast Cancer, and we are a nonprofit organization that's dedicated to improving the quality of life of the cancer community. And how we do this is by increasing access to breast cancer rehabilitation, as well as lymphedema therapy. We primarily do this through our financial assistance program, which provides those in need with funding to pay for appointments of physical therapy or occupational therapy. But this year we launched these educational webinars, like I mentioned, just to bring more information to you, to help you in your recovery. It is really our goal to make sure that everyone has access to the care that they need and deserve to support their recovery during and after breast cancer. So just a little disclaimer, this webinar is for informational purposes only. If you have specific concerns about your own recovery or health, please make sure to reach out to a professional within your community. If you need help connecting with a physical therapist or occupational therapist who specializes in breast cancer rehab or lymphedema therapy, we are here to help you even just connect with those professionals, because we recognize it's sometimes hard to find those people within your community. So don't hesitate to reach out to us. And today I have the great gratitude of introducing Babz, who is our speaker. She is an incredible occupational therapist, certified lymphedema therapist, as well as a certified yoga instructor, who specializes in cancer rehabilitation as well as lymphatic health. But she's also the founder of Lymph Flow Yoga, and I'm super excited for her to share that with you today. So Babz, I will hand it over to you. Thank you so much for joining us today.
Awesome. Thanks, Amanda. I'm super happy to be here, and thanks to those of you who came today live, and for those of you who will be watching the recording, hello. And yeah, I'm just really excited to share this evidence-based recommendations and this research article, and then give you a little taste of Lymph Flow Yoga, and then answer your questions and kind of open this up to a nice discussion and a positive way to share and encourage education. So today we'll talk about the article. And so do you want to go back to the objectives, or did you? Yeah, perfect. And then we'll talk about early signs of lymphedema. So some of you here might already have lymphedema. Some of you might be at risk, or some of you might be like, I'm not really sure. So we'll kind of talk about that. We'll talk about what lymphedema therapy can be like. I'll talk about Lymph Flow Yoga and the benefits, the guidelines for the article for individuals at risk or with lymphedema, and then we'll engage in a chair, about 15-minute Lymph Flow Yoga practice, and then Q&A. So we're going to fit it all in today, but it's going to be a really good webinar, and I'm excited to be here. So thanks again. Next slide. Okay, so breast cancer-related lymphedema. So I became a lymphedema therapist to help support my mom, who is a breast cancer survivor and unfortunately has lymphedema. And so essentially it's a chronic buildup of swelling that happens because of certain breast cancer treatments. So radiation, lymph node removal. There's a couple other key factors that I'm going to be talking about, but essentially, lymphedema is caused by a protein-rich fluid that builds and builds and then has a harder time coming out and moving out. And it can be a chronic and progressive condition if not treated, and not treated early. So that's kind of a little bit about what lymphedema is, but we'll get more into it after as well. So here's my mom, and there's many different signs and symptoms of lymphedema. It can be pretty specific to person, but overall, if you're feeling a sense of heaviness, fullness, if you're noticing that your rings aren't fitting, your watch is tighter, your clothing fits differently. Also, if you look in the mirror and you examine your arms and you notice you have a little bit more fluid, maybe you're surrounding your underarm. If you have difficulty seeing the bony prominences or the veins. So it can be very slight at the beginning. So kind of becoming aware and just monitoring how your limbs look and checking in with your baseline. But those are the typical signs and symptoms of the early onset of lymphedema. And I would encourage all of you, if you're experiencing any of these, to immediately talk to your healthcare provider, your doctor, your PCP, even just to say, hey, I'm noticing this and I'd like to get it checked out, because early intervention is really key for lymphedema. So lymphedema therapy. So there's two phases of lymphedema therapy. The first phase is called complete decongestive therapy, which we do massage, compression bandaging, which you see in the picture here, as well as skin care and exercises. So it's a pretty intensive treatment to decongest the limb. So often it's 3 to 5 times a week for 2 to however many weeks it takes. And then you're fitted into a well-fitted compression garment day and night, potentially. And then you're continued to monitor and make sure that that garment is keeping the swelling down. Phase 2 is the maintenance phase, where you now have the garments, you have the exercises, you have the education, and then you continue to complete all of the exercises yourself and manage it independently. And this is done through certified lymphedema therapy. So like Amanda said, if you're in an area that doesn't have therapy, reach out to us. We can kind of guide you to somewhere nearby or online resources, but it's really important to find a lymphedema therapist who can help you to monitor your symptoms, answer any questions, and really cater your therapy to you, because even if you have the same exact diagnosis as someone else, you're going to have different symptoms and a different course of your journey. So it's really important to get the help you need and deserve. So that brings me to Lymph Flow Yoga. So back in 2020, in the height of the pandemic, all the outpatient clinics shut down. So I needed a way to help my patients. So similar to Amanda, we found this kind of need for services and this kind of gap of care. So I started my YouTube channel, Balance with Babz, which has over 700 videos now of different practices to teach you how to, again, in that maintenance phase, help your lymph flow, help your body, encourage the movement, help your lymphatic health. And it's really a practice for everybody, but specifically helpful if you've been diagnosed with cancer, lymphedema, lymphedema, or some type of disruption in your lymph flow, or if you're at risk. So there's 4 major components, which we'll do today, but the 4 components of every single practice, and this is what it really stands it apart from a typical yoga class. So as a yoga instructor, I love any type of yoga, and I highly encourage all my patients to try various types, but this type of yoga that I created is different because it includes self-manual lymph drainage. So we do a manual lymph drainage warm-up routine before we do our yoga practice to stimulate our central lymphatics, get everything in motion, get it moving, so that when we do our exercises, that fluid has somewhere to go. So the 4 components are self-manual lymph drainage, breathing exercises, specific yoga sequences that starts proximally and then works distally, and then mindful meditation is the 4th component. So the benefits, I think, are different for really every person who engages in this practice. Even someone without a lymphatic disorder or someone who is at risk can help themselves by doing this practice, just to really encourage the flow and keep everything moving. And when things start to get stagnant, that's when things can go wrong or things can build up. So it helps to promote fluid balance. It eases physical and mental tension. We work a lot on mind-body connection, easing and relaxing into the practice, range of motion, flexibility. I know often after breast cancer treatments, the range of motion, the shoulder can be affected. So we work a lot on chest, heart opening, core contraction. We also do a lot of self-massage that desensitizes any areas that might be sensitive. And also, I think above all, it helps to promote community and accountability and reduces isolation, because I know many of you who are going through this, there's so many people who have breast cancer, had breast cancer, are at risk for lymphedema, or have lymphedema, but sometimes it might feel really isolating. So I think having this community is really helpful, just to be a part of something that other people have gone through, and have that really sense of comfort and support with one another. So yeah. Thanks. So now we'll get into the article. That's probably why all of you are here. So I have printed it here, and if you had signed up before yesterday, I'd sent all of you the article. So this was published in 2024. And so it's really exciting news because a consensus like this hasn't been published in a really long time. So what they did was they put together a team of lymphatic experts, and they were together for a 2-day summit and basically took all of the current research out there, came all together, kind of put it all into pieces, and then created this article, which is, it's a pretty short article. It's an easy read. And then they developed this chart here at the bottom that identifies evidence-based recommendations for individuals at risk and then with. And basically what I did is I took that chart and made it into a more reader-friendly guideline. So I can, if you didn't receive the email with both of these, let me know and I can send it again. But this is something really good to print out or keep on your computer, just to kind of look at, if you're, especially if you're at risk, some things just to go over, and then how you can really monitor and maintain your lymphedema if you have lymphedema. Okay, so we're gonna go kind of piece by piece with all of these different recommendations. So the first thing that they talked about in the article was surveillance. So we'll go each section, we'll talk about at risk, and then we'll talk about with lymphedema. So it's really important when you have been diagnosed with breast cancer, if you've had lymph nodes removed, if you've had radiation, that you have a baseline measurement. So I would highly encourage you to right away get teamed up with a lymphedema therapist, or even monitor yourself for measurements of your arm. Because if you don't have a baseline measurement, then you're not going to be able to really tell, besides the visualization of your limb, how much your arm is increasing. So screening is really important, especially if you're at like a higher risk for lymphedema, which we'll talk about later on. So for those at risk, I would say monitor. Even get a little self-measuring tool. There's some on Amazon that clip into itself, and then you put it on and it cinches in. Even if you don't have access to a lymphedema therapist, taking measurements in the same area maybe once a month, or if you notice, okay, this arm's feeling a little bit heavier, then taking those measurements just to make sure. That also might give you a peace of mind that, hey, my wrist was 17 centimeters last month, it's still 17. So I would say the biggest thing for individuals at risk is really just making sure to monitor and to make sure that you're taking those measurements. For individuals with lymphedema, if you already have lymphedema, it's really important to, once you're done with that phase 1 of therapy, to continue to see a lymphedema therapist every 6 to 12 months. One, it's important to go for screening and to determine if your arm you're maintaining well, everything's going well, and also to have the therapist make sure that your garments are appropriately fitting you too, because 6 months to a year, a lot can happen. You might lose weight, you might gain weight, things happen. So I would say, or the recommendation for this article, and also what I would say is having that strict kind of schedule with your therapist every 6 to 12 months is really important for the longevity of your health of your limb. Okay, section 2 is risk factors. So these are, and this again is straight from the article. This is not something that I wrote, but I'm just bringing it to all of you as education and awareness of what they found. So the risks for lymphedema are surgery, so having an axillary lymph node dissection or a sentinel biopsy, and they found that the full dissection, you're at a 3 times greater risk than if you just had a sentinel biopsy. Your patient factors, so your body mass index. So if you haven't heard what body mass index is, you can easily Google what is my BMI, and then it will give you a calculator of to input your height and your weight. And so if your BMI was above 25 at diagnosis, that's going to put you at a higher risk. If you are Black race or Hispanic ethnicity, that also is going to put you at a higher risk. Treatment factors such as lymph node radiation and some types of chemotherapy. And then also if there's any complications along your journey. So if there was skin infections such as cellulitis, if you had a seroma or axillary web syndrome, also known as cording. So those are the major risk factors. So if you're going through these and you're like, yeah, I have that, yeah, I have that, yeah, I have that, yeah, I have that, but you're at risk for lymphedema, I'd really team up with a lymphedema therapist to say, okay, if I'm noticing these symptoms, what should I do? For those with lymphedema, it's important to keep your body mass index below 30. So a risk factor is if you go above 30. So if you're gaining weight, that has a direct correlation to your lymphedema. So maintaining a good balanced diet, I say everything in moderation, drinking plenty of water. Also, if you've had recent skin infections, cellulitis, stroma, or cording, that also can increase the disruption in that flow, which could cause a flare or cause more fluid to fill in that arm. Third is patient education. So this is what Amanda and I talk about every single day and what we really try to put out in the world. But education is key. So coming to these webinars, so pat yourself on the back for just even coming today or for watching this recording, because the more you know about something, the more you're going to make an educated guess and protocol for your own body and mind. So it's important for those at risk for lymphedema, to understand your individual risk factors that we just went through, understand the signs and symptoms that we talked about, and then also seeking more education. If you're like, what did she say? Or what is this? Or how am I at risk? Really talking to someone to talk about your individual cases is super important. And for those with lymphedema, it's just as important to continue up on the education. Every, I would say, 6 months to a year, there's new garments coming out. There's new research coming out. There's a lot more talk about lymphedema in the lymphatic system now than there ever has been. So following Amanda on Instagram, following me on Instagram, following organizations that you trust and that you can go to get little blurbs of digestible information will really help you to not be overwhelmed, but just alert and aware of what's going on. Exercise. So one of my favorite topics. So at risk for lymphedema, it's super important that you have, for at risk and for lymphedema, you want to have a good exercise routine. And that's whatever it might be that you like. If you love to walk, if you love to do Zumba, rebounding, Lymph Flow Yoga, whatever it might be, it's really important that you just keep your blood flowing, because that's going to help to keep your lymph flowing. So the article said that supervised, slowly progressive strengthening and aerobic exercise is encouraged. So way back when, I don't know, 10, 15 years ago, a lot of the recommendations were do not lift weights, do not vacuum, do not exercise. Like they had pretty strict guidelines for individuals, for individuals who went through breast cancer treatments. They're now saying if you do a slow, progressed, and build upon each week, that you will be fine. So if previously you were lifting 15 pounds or so, and then after surgery, you might want to go down to 2-3 pounds and slowly bring yourself up. And the purpose of going slow and gradually increasing is that you don't want to overwhelm your lymphatic system. So if you've had lymph nodes removed, you've had recent cording, or whatever it might be, doing a lot of exercise increases the blood flow. And that's an increased amount of fluid that the lymphatic system has to pick up and bring back. So if you do this in a slow and controlled manner with the guidance from a therapist, or even just slowly building yourself up on your own, it won't overwhelm the system. You'll give your body time to heal and time to build up slowly. And so that's the same for at risk and for lymphedema. Blood pressure. So this is a question I get often from my patients. And for those at risk of lymphedema, they're saying that there's been no research indicating that if you have blood pressure, that's going to directly lead to lymphedema. But in my mind, kind of best practice or more proactive or preventative care, if you had lymph node removal on your left arm and your right arm is free for them to do blood pressure, I would just do the one that hasn't been affected. So the research is saying that if you do it on that arm, you're not going to get lymphedema right away, but there's no real studies that have proven this right or wrong. They're not going to test someone over and over again to provoke a lymphatic response to potentially put someone at harm. So I think best practice, excuse me, would be just to use the non-affected arm if possible. And then if you do have lymphedema, then they're recommending you just avoid that blood pressure on that arm. So I would just, again, use an unaffected arm. And I recently had a question, what if I have lymphedema in both arms? Then they can do it on your calf, or I would say if they have to do it on the arm, do it on the arm and then do some lymph drainage right afterwards just to support your body. But I thought that was a good question that I received online. Okay, so this is the same, in the same boat. So this is blood draws and injections. So again, at risk for lymphedema, they're saying that this has not been shown to increase arm volume or increase or cause lymphedema. But again, it's not been proven, it's, so I would say use the other arm if they're going to do a blood draw. And for individuals with lymphedema, they're saying just don't do it on that arm. Use the other arm. Skincare. So this is similar for those at risk and with lymphedema. Skincare is super important because if you hydrate and you protect and you soothe in the skin, those little vessels that are carrying the lymph fluid are superficial to the skin. So if the skin is moving and stretching and hydrated and there's no cracks in it, then those vessels have a easier pathway or a movement to get that fluid circulating underneath the skin. So protecting your skin, sunscreen, bug repellent, washing the skin, moisturizing. If you happen to get a cut or you're gardening and you get a slice or you're doing the dishes, right away clean it and make sure that you don't notice any signs or symptoms of cellulitis. And those signs and symptoms would be if you cut your hand and then you start to see a rash, if it was warm to touch, if it swelled up, and if that rash started to grow or started to increase. If my patients reach out to me and say, Babz, I'm noticing a little rash, I say immediately use a Sharpie, draw a circle around it, make sure you get the outline, and then immediately call your doctor and go to get treatment, to get antibiotics. And with that marker, you can see, okay, yeah, now it is growing a little bit. So any type of rash, cut, anything like that, treat it right away like you would with any kind of cut. Wash it good, but then really monitor for any other symptoms like a fever, increased redness, a rash, or anything else that might kind of sound the alarms. And that's the same for both seeking medical attention if those symptoms do occur. Okay, hopefully I'm not going too fast for all of you. The next is elective surgery. So this is, say you had breast cancer treatment, right lymph nodes, axillary lymph nodes were removed, and you had radiation, and then you fell and you had a distal radius fracture or a wrist fracture. This is saying if you have lymphedema in that arm, or if you're at risk, just make sure to consult with a surgeon before the surgery and say, this arm is at risk for lymphedema, or this arm has lymphedema. How can I best prepare for this surgery? Same thing if you had to get carpal tunnel release or whatever it might be. It'd also be good to request an evaluation from a lymphedema therapist before the surgery and then immediately after to, again, get those baseline measurements, see, okay, you're good now, let's prepare, let's put a plan in place. You're going to wrap the arm, you're going to put the compression on, whatever it might be, but just having a plan in mind before and after. So things are going to happen. And so I think best case or best plan is to discuss with the surgeon and also talk to a lymphedema therapist about what to expect and how to monitor and protect yourself. Okay, compression. So if you have lymphedema, you're going to be wearing compression because that's what's going to keep it down. It's what's going to keep it flowing. There's many different companies and many different types of garments, day and night, but the research is saying that wearing compression is key to maintain the arm at a good level. For those at risk, well-fitted garments, I think there was one research study that was saying that a well-fitted garment right after surgery and to be worn for a couple months would help to reduce the risk. With my patients, I tend to go with the more prepare, like kind of give my patients the tools and then let them decide. So there's no research saying that every single person who has breast cancer needs to wear a sleeve. But they're saying that if you're feeling these symptoms, then it might be good just to have one, and prophylactically just to help to encourage the flow if you're nervous about this, or if you're at those high risk populations. But they're basically saying that wearing the garment would help you if you're in that high risk category that we talked at the beginning. But again, this is something that you can kind of talk through with your therapist or your doctor to say, am I in that high risk population, and would a sleeve help me in my situation? Because it's not for everyone. And honestly, a poor fitting sleeve is going to do more damage than not wearing one at all. You know, if you just wear one from the wrist up, and then it's going to puff up the hand. So this can be a little bit of needs to be a bigger and more thought out conversation for you. So that's for compression. Air travel. This one's just interesting to me. For those at risk, again, similar with the blood draws, the blood pressure, they're saying that air travel is not associated with a increased risk. Or if you fly, you're not going to get, it's not, the risk is that you're not going to get lymphedema. But and wearing a sleeve is not required. But then again, this hasn't been studied. They haven't sent 20 people with breast cancer who've had lymph nodes removed on the plane and said, let's see what happens, you know? So I think it's this, again, with the compression, is a very person by person base. For those with lymphedema, I would recommend wearing your current garment that you're wearing every day if it's well fitting, if it feels good. But for those at risk, again, it's a deeper conversation of, well, when you fly, do you feel like your ankles swell? Do you feel like the higher altitudes, does that have an effect on your body? You know, all of us have different lymphatic systems. So maybe your lymphatic system is more affected by it. So wearing a sleeve might just really be preventative for you and helpful for you, or give you that security that that's going to keep you down if your body does swell. So again, this is another conversation that I have with my patients, and I might be an overprotector and kind of I don't know. But I think it's, if it makes you feel good, if the garment fits you, if you're comfortable in it, if it feels fine, then I'm more of in the boat of why not wear it to prevent. But the research is saying it has not been associated with increased risk of lymphedema. Okay. This is temperature. Whoops, that's my mistake. It should have said temperature. So for individuals at risk of lymphedema, they're saying that the hot climate does not appear to increase the risk of onset of breast cancer-related lymphedema. But they did mention one study that they looked at saunas and that found that that did increase the risk. For those with lymphedema, hot temperatures, I mean, if you have lymphedema, you already know this. If you're in the hot sun in the summer, you feel your body swelling. And again, saunas should be avoided. But for temperature-wise, when I talk to my patients and when I talk to my mom, I just think about trying to keep your body at a cool temperature. And I never say, no, you cannot be in the sun. No, you cannot go to the beach. No, you cannot never go in a sauna. Never. I'm not in that boat of you can never do any of that, because it's your body. And I think the biggest thing is monitoring how your body responds to these things and knowing what to do when your body does increase. So having the tools to, okay, I'm going to do a little bit of manual lymph drainage. I'm going to do my pump. I'm going to kinesiotape. I'm going to rebound. I'm going to deep breathe, you know, whatever your go-to self-care practices. I think that's more important than saying, don't do this, do this. But as for the article and for the research, at risk, hot climates are not a risk for lymphedema, but saunas should be avoided. And then for lymphedema, basically, hot temperatures can affect the lymphedema, and saunas should be avoided. Okay. And I believe this is the last section. But so self-screening. So we talked a little bit about this earlier when we were talking about surveillance, but it's really important that you are aware of what your triggers may be, how your body feels on a day-to-day basis. Noticing, again, visualization of your limbs in the mirror, especially this one, bending the elbows, going like this, because we're not really looking underneath like that very often. So I think using the mirror as a visual cue will help. And then also seeking help from a certified lymphedema therapist when you are experiencing a flare or something happens, just to have that person to support you in your medical team, like a primary care therapist, having that person to guide you and be your support system is really critical. Okay, so again, these are the printable handouts that go through all of that. And I know I went through that fast, but we'll have time for questions. But basically this just gives the highlights of all of these practices. And again, these are just the top 12. There's so many other categories and things we can talk about in the lymphedema world, but these are just the main elements that have been researched right now. A lot of this hasn't been researched, like rebounding and all of those kinds of things, but I think this gives a good foundation for how you can either prevent or reduce your risk and how to live and reduce flares if you're living with lymphedema. So that's the QR code you can scan there if you want to download those for your therapist or for you, or to bring in to talk to your therapist about. Okay, good. So now we'll do about 10 or so minutes of our Lymph Flow Yoga practice, then we'll come back and do some questions. But this is the ways you can practice with me currently. So like I said, I have a YouTube channel. I have weekly live classes and events and community membership. So I believe this will link you to my website that you can learn more. But now we'll engage in a nice practice, get our lymph flowing, because I know we've been sitting for a little bit of time, and then we'll come back and I'll answer all of your questions. So I hope you enjoy. And Benny will be present. Okay, so welcome everyone. We'll start in a seated position. So this can be on your mat, in a chair, on the edge of the couch, on your bed, and then we'll just place our hands into our lap. So this Lymph Flow Yoga practice will be to encourage upper body lymph flow, and it will be a brief practice just to get you a little taste of how you can improve your health and well-being. So let's just close our eyes and relax our shoulders. Taking a slow breath in through the nose. Open mouth, exhale, let it go. Slow breath in. And let it go. Breathe in. And out. And then we'll begin our manual lymph drainage warm-up routine. So this is what we do before every Lymph Flow Yoga practice to stimulate our central lymphatics. So you can take your hands across the body. So either hand like this, or you can do one hand at a time, whatever feels better in your anatomy. And then we're going to start to create some circular pumps here at the collarbones. So this area right here at our sternal notch is where there's two major drains that take the lymph fluid, the filtered lymph fluid, and bring it back into the heart. So if you think of a bathtub, this is the position here, the major drain. So if we unplug here, if we get this stimulating, then the fluid can then move and drain. And then we'll slide our hands up to the neck. You can go like this, or you can hold your hands like this. And then we'll just start to drain that fluid down towards the collarbones. So in your body, you have around 700 lymph nodes. A majority is in your abdominal region, but then a big amount is right here around your neck. So if you're experiencing breast swelling, chest swelling, armpit, getting this central flow will help. Good. And then we'll come to the shoulders. We'll stretch the skin of the shoulders as we bring our elbows up and down. Breathing in and out here. Good. And then we'll take one hand to the armpit. Either rest the hand down, up, or you can start to move that shoulder as you pump into the armpit. So you're pumping towards the breast, just stimulating. And it's okay if you've had lymph nodes removed, or if you Only have a few lymph nodes in this area. We want to do both sides because that will help encourage. Good. And then we'll come to the other side, pumping at the armpit as you move through the elbow, breathing in and out. Good. And then we'll take our fingers like piano fingers, and then we'll go along the sternum here. So walking up and down, you have lymph nodes along your sternum. So helping to encourage drainage there will help move that fluid from the breast and the armpit and the arm. Good. And then we'll imagine a line's coming down the center of the body and then across. And we'll place our hands in this upper two quadrants. We're going to create some circular pumps here. So getting some activation here. Like I said, this is the largest area of lymph nodes. So if we encourage lymph vessels to pump and move, that will help our overall flow. And then come to the lower half. We're going to pump here, just some circular pumps. This is a good routine to do before or after your shower, before you exercise. Good. And then we'll come back up to the chest, creating some circles here, closing your eyes. And then release the hands down into the lap. We'll slowly draw our chin towards our chest. And then nice and slow, start to create a gentle neck circle. You can keep the hands where you are, or you can take one hand on top of the other and gently press down so that you feel even a little bit more stretch throughout the neck. So listen to your body. Moving the neck and stretching the skin helps to encourage the lymph vessels to move. And then reverse the circle. Breathing in and out. And then coming back to center, release the arms if you had them at the neck. We're going to draw our shoulders up, back, and down. You can swim the arms with me if you'd like, getting a little bit more movement and contraction. The way the lymph flows is through massage, skeletal muscle contraction, and deep breathing. So breathe in and out. Good. And then we'll draw our fingers towards our shoulders, tap the shoulders. Then we'll inhale, reach the elbows up, out, and down, squeezing the shoulder blades. Good. Breathing in and out, getting some nice movement, some rhythm. Good. And then soften the hands down. We'll take our left arm across the body. Inhale, reach our right arm up, side bend. This is a very good one to encourage the stretching of the side body. If you'd like a little extra stretch, you can bring your hand behind your head, gaze up towards the sky, and tilt that elbow towards the sky. Breathe in here. Exhale, soften. Another breath in. And then come back upright, draw the elbow forward, and then cross it over. Left arm lifts up. Side body stretch towards the right. Staying here or bringing the hand behind your head. Elbow lifts up. Breathe in and out. Slow breath in and out. Slowly, elbow comes back to center. Hands come down. Benny says it's time for sleep. And then we'll draw one arm forward, one arm back towards the hip for a gentle spinal twist. Inhale, center. Exhale, twist. Breathe in and out. Breath into center. Exhale out. And then hands to the hips, open up the legs a little bit wider. For seated cat and cow, we're going to inhale, draw the chin and the chest forward. Exhale, round and contract. Breathe in, glide forward, inhale. Exhale, round. As you inhale, you're opening up through the heart space, getting the skin to stretch. Exhale, you're pumping, getting that core contraction. Last one, breathe in and out. And then we're going to come back to center. Inhale, reach your arms all the way up. Hands come down through heart center. And then we'll take a moment of stillness, letting your arms relax into the lap, letting yourself soften into your chair. Close your eyes. As you breathe in your mind, say, I tried my best. Exhale, and I release the rest. Inhale, I try my best. Exhale, and I release the rest. Find a moment of relaxation in the entire body. Sending a wave of gratitude to your mind and body for being here, for balancing your energy, improving your lymph flow, being part of a community that understands and supports you. And then we'll inhale, reach our arms up together one more time. Exhale, hands come down to heart center, and we can bow to one another to share our gratitude for one another. Thank you all so much for being here. And I'm just grateful that you took the time to practice with us, learn with us. And now we'll open it up for some questions or discussion. And I look forward to hearing from all of you.
So as Babz mentioned, we will open it up to questions. So if you want, like I mentioned at the beginning of the video, the webinar, if you want to ask your question on video, please feel free to, or you can leave your question in the chat. So Julie, would you like to ask your question first?
Yes, thank you. So once you have lymphedema, is it a lifelong condition, I guess? Or I know you manage it with, the exercises, which by the way, were wonderful. But is it, once you develop it, it's going to be a lifelong condition?
Yes, unfortunately, it is. Once your lymphatic system has been disrupted from cancer treatments or from certain things, it's always going to be disrupted. And lymphedema typically is a chronic progressive condition. However, I feel like those words feel heavy to me and feel strong and feel dark. But I would encourage you to, I think, trying all these self-care practices, encouraging your lymph flow, helping to monitor, and seeing what is your best version of your lymph and what can you achieve, and how can you live with this diagnosis so that it's not your whole soul focus, living with it versus living for it. Amanda, would you agree with that or?
Yeah, absolutely. And I also just want to highlight something. I think one of the biggest misconceptions when it comes to lymphedema is that nothing can be done to improve it or to improve your function or your mobility and your quality of life. And I think that's really what we want to highlight with this webinar is there are therapists out there, certified lymphedema therapists, that can really help you manage your side effects, manage your swelling, and really help you to be more functional or just help you to live better with lymphedema. So I just want to highlight that point as well.
Yeah, I also think that even though it's said to be a chronic progressive diagnosis, it's not necessarily progressive if managed or treated. So yes, it may be chronic and you might have it for the rest of your life, but it doesn't have to worsen. If you get the right care, if you're really on top of it, if you're teamed up with a therapist that supports you, it can be well managed. Did that answer, Julie?
Absolutely. Thank you so much.
You're welcome.
Larissa, do you want to ask your question?
Sure. So it's like a two-part sort of question. I have a port on my side where I get the chemotherapy, and I'm going to have it for probably the next 6 months also. And when we're doing the exercises, which were amazing, I am a yoga instructor, so I knew how to modify it. But like, do you suggest I only do it on one side at a time when we're doing that crisscross so it doesn't interfere with the port side? I wasn't sure what your thoughts were on that since.
Awesome question. And hello, yoga instructor. That's awesome. Yeah. So you could even go like basically just that one side or kind of right in the center. So where the collarbones meet cut in through there,
Yeah.
even if you just kind of massage right through there. Also, if the port's right here, you could go above, like, well, it's actually coming through there. So maybe go surrounding, but you're absolutely right. I wouldn't go right on it because you just don't want to move it and shift things.
Cool.
But center, even if you kind of go more towards the sternum, you have lymph nodes there. So that's going to get the flow pumping and moving.
Okay.
And even the neck stretches too, that's going to encourage movement and pumping of the vessels in that area. But that's an excellent question, and I'm happy that you modified.
The next part question was literally just today. I got diagnosed with axial cording, which was so, I was like, wait, this is good timing. I know it's not the same thing as lymphedema at all. However, they did give me a sleeve to say that to try and move what was sort of starting to build up from the cording. So I didn't know if you would have the same recommendations for the way that this went for me. Was I had a sentinel node biopsy. So I had 3 lymph nodes taken out, and that was in November for that tumor removal on the biopsy, and the lymphs were positive. So right now they're thinking they want to give me an axial node dissection, which would be in 3 weeks. So I was like, okay, if I have this cording, how do I just work with this first? Do I do these kind of exercises? Just anything that you would recommend.
Yeah, actually, interesting. Well, first of all, I'm sorry that you're going through that. That can be really painful and uncomfortable. I actually just put together a free axillary web syndrome cording resource guide.
Okay.
And there's a video in there that shows you different exercises to help to encourage the movement. So
Awesome.
I can send that, or it's in my, when you scan for the other resources, it's in that lineup. But I agree with the sleeve. I think that if that's comfortable, it helps move the fluid out. And cording is something that can all of a sudden just resolve. So it's kind of a random
up and down.
Yeah. So I would say, in that resource document, it gives kind of the key tips of what to do. But I would continue to monitor and check with your medical team about it. And then follow that video, because it could just they often just release. And then you're able to get the motion back. So hopefully in your case, it can resolve soon.
It's not impeding my movements. I mean, I teach every day. I'm teaching. I'm like, I can do all the. I just felt it. Like I actually felt the cord. I'm like, what is that? Like, so I'm glad I felt it and knew my body to ask. But that was my only other question. So thank you so much. I appreciate it.
Good. I'm glad it's not impeding your motion. That's good.
We do have another question about someone asking about hot tubs and if hot tubs kind of follow the same principles as saunas.
I had the same exact question. So saunas was the only research or the evidence that they found. They have never done, or not to my knowledge, a research article or study about hot tubs. I know so many of my patients ask me this question too, and I basically say, the body swells when it gets overheated or overworked. So if you can maintain a good temperature, so maybe go in the hot tub for 10 minutes, sit on the side, put a little cold towel around your neck just to regulate your body temperature. And maybe just don't go in for, 20 minutes and then come out. So I think low and slow is always my motto. And again, I'm not the type of person who's like a hard no on things. I mean, some things, but with hot tub, if you have a hot tub at home and it was your nightly routine to go in every single night, it if I got the news that I could never do that again, I would feel crushed. So I think, again, back to our kind of discussion earlier, monitoring your body temperature, your regulation of that temperature, and seeing, like, if I do this, does this make me swell? And also, again, I don't know your specific situation as any of these questions or any of these participants who are asking questions. So asking your therapist, like, is this okay? Or can I try this? And if my body does swell, what do I do?
Does anyone have any other questions for Babz?
I just wanted to say thank you as someone who has been dealing with lymphedema for the past like 3 years. I definitely wanted to just kind of give a comment that it definitely can be managed. I have like largely been living with it being like pretty well managed. I had a recent flare up, which was really distressing, and I'm still in the midst of it, but I've been seeing my lymphedema therapist and I'm going more often. Like I was going like once a month for like maintenance care is what I call it.
Mm-hmm.
And then I stopped, you know, and then I didn't stop. I was still going, but I had a flare up and I said, okay, so I started going weekly again and I'm already seeing my swelling go down. So just like naming that, like, you know, having the proper care can make all the difference. And like, I feel like you know, I'm still moving my body. I'm still exercising. I also like teach yoga and I like, so I can still do all those things. And so just to give the positive side of it, because it can feel really distressing when you get that diagnosis. And I got it like years after my initial surgeries and stuff. And so it definitely was not what I wanted to hear, but I'm glad that I have found a way to kind of manage it. And so just like naming that. And I just, again, want to say thank you because it was really helpful to hear some of those recommendations and like just get further information and to go through that flow because it was really nice to go through that. So thank you.
Thank you so much, Justine. That is very powerful because I can stand here all day as a lymphedema therapist saying it's going to be okay. You're gonna need to do this and this and this. But having your own experience and your voice really, I think, shines brighter than anything I could say. So I really appreciate you sharing about yourself, and I'm glad you're a yoga teacher too. That's awesome. But yeah, I really appreciate you sharing that because it means a lot to me and means a lot to probably everyone who will watch this. So I appreciate that.
Thank you, Justine. Anyone else have any last minute questions for Babz? All right, so thank you so much, everyone, for joining us. I hope this was very educational for you and helpful for you. If you want to connect with Babz, you can connect with her just through scanning the QR code on the previous one. If you want to connect with us at Well Beyond Breast Cancer because you need help finding a lymphedema therapist within your community or a physical or occupational therapist, please do not hesitate to reach out to us. That is what we are here for, is just making breast cancer rehabilitation, lymphedema therapy more accessible to you. Or if you do need financial assistance to get these services, that's what we are here for. We are here to help in any possible way that we can. So feel free to reach out to me by email, on Instagram, whatever works best for you. We are here to help. So thank you again so much for joining us. Thank you, Babz, for all of this wonderful information. I know that it was super helpful. And I do just want to highlight that we have another educational webinar lined up in June. So on June 10th with Dr. Alex Hill, and she will be speaking all about sexual and pelvic health during and after breast cancer treatments. So registration for that one will open at the beginning of May, but I just want to have it here as a little save the date for you all. So you can expect us to have these educational webinars every other month, all on a different cancer-related side effects. So thank you again so much, everyone, for joining us, and I wish you a great rest of your day. Thank you, everyone.